this is, my name's Natasha James, and we're going to do a head-to-toe assessment. Today we're going to be performing this. This is my patient Melanie, and here is her consent form. Okay. All right. So I'm going to review my orders. Can I come in?
Yes.
Hi, my name's Natasha James. I'm a nursing student at Germanna Community College. So today we're going to be performing a head-to-toe assessment on you, okay?
Mm-hmm.
All right, so before we get started, can you go ahead and tell me your first and last name?
Melanie McAfee.
And your date of birth?
12/05/1987.
All right. And do you have any allergies?
Biexin and sulfa.
All right, and make sure those are on your chart. All right, so we're gonna go ahead and wash my hands and provide privacy for you. So first we're gonna start with your level of consciousness. Can you tell me what year we're in?
2016.
Okay, and the month?
March.
And today's date?
March 2nd, 2016.
All right, good. So first, for time purposes, we have already reviewed her health history with her, and we have also done the weight and height as well. So we're going to go ahead and start with your vital signs. So we're going to do your blood pressure. Do you have a preference on which arm you would like?
Nope.
Try this one. Alright, so I got 112/68. Does that run for normal range for you?
Yes, it is.
Okay, good. Alright, so next we're going to do your temperature. And we're going to simulate this, so just place this under your tongue and don't bite down. Alright, we got 98.5. Looks good. Alright, so now we're going to do your pulse. Let me see your arm for a second. Can you watch? Alright, so after a full minute, it looks like your pulse is 68, and as well as your respirations are 16.
Okay.
So those are within normal range. Alright, so now we are going to go ahead and get started on your assessing your cranial nerves, okay?
Mm-hmm.
So first it looks like your speech and everything is very fluid. Have you noticed any slurred speech or anything lately?
Nope.
Okay, good. So that seems to be good and intact. So now we're going to test your grips. So can you squeeze my fingers?
Okay.
Okay, good. And then push on my hands. 1, 2, 3.
Okay.
Now pull back. 1, 2, 3.
Okay.
And then do your feet as well. And press down. 1, 2, 3. And pull up. 1, 2, 3. All right, good. Nice strength in your arms and legs. So now we are going to go ahead and test your olfactory nerve. So normally we would ask the patient if they have any sensitivity to smell or anything. Do you have any sensitivities?
No.
Okay. So can you close your eyes for me? I'm going to swipe this under your nose and just tell me what you smell, okay?
Alcohol.
Okay, good. So your olfactory nerve is intact. Next we're going to check nerve 2 for your optic nerve. So we're going to go ahead and look into the fundus. Alright, nice and orange. That's good in your left eye. Alright, and into your right eye. Looks good. Alright, and normally I would use a normally I would use the otoscope to check for the eye into the fundus. All right, so now we're going to test your eye movement. So I want you to, don't move your head, but just follow your pen light with my eyes, okay? All right, good, that's intact. So now I am going to just dilate your eyes and just check your measurement for your pupils. Okay, that looks good as well. All right, so now I'm going to go ahead and place my hands behind your ears and just tell me when you can see my fingers, okay?
Yes. Yes. Yes.
All right, so it looks like nerves 3, 4, and 6 are intact. The oculomotor, trochlear, and abducens are intact. All right, so next we're gonna do your nerve 7, which is your facial nerve. So can you go ahead and make a big smile for me, and a frown, and puff up your cheeks? Good, so nerve 7, the facial nerve is intact. So now we are gonna test your nerve 8, your acoustic hearing. So I'm gonna get my tuning fork and tell me when you can hear it.
Can hear it. Yes. Yes.
All right, and then tell me when you can hear the vibration.
Yes. Yes.
All right, good. So your acoustic nerve is intact. All right, next we're gonna test your nerve 9, your glossopharyngeal nerve. So we're gonna do your swallowing. So go ahead and swallow for me. All right, good. So your glossopharyngeal nerve is intact. All right, and then next we're gonna do nerve 10, your vagus nerve. Normally we would check for the gag reflux, so we're just gonna simulate this. All right, good. So your vagus nerve is intact. Next we're gonna do nerve 11, the accessory nerve. So go ahead and shrug up for me one more time. All right, so your accessory and spinal nerve is intact. All right, and now we're gonna do the hypoglossal nerve. So go ahead and stick your tongue out for me. All right, hypoglossal nerve is intact. All right, so all of your cranial nerves seem to be intact and working and well. So now we're gonna move on to your head. So now we're gonna inspect your skull. Do you have any noted lesions or anything that you know of?
Nope.
Okay. All right, and just let me know if you feel any pain or tenderness, okay? All right, your scalp looks good, your hair looks nice and healthy and clean, so that's good. All right, so now we're gonna move on to do a little bit more inspecting of your eye.
Okay.
So now I'm gonna test your sclera and your conjunctiva. Can you look up for me? All right, nice and pearly white and red at the bottom, which is good. And you've never had any lesions or discharge from your eyes or anything?
No.
Okay, that's good as well. All right, so now I'm gonna take this pen light and look into your, to check your lens and your eye color as well, okay? All right, looks good. And you have green eyes, blue?
Bluish hazel.
Blue, yeah. And color looks good. All right, now I'm gonna shine this pen light into your pupils and we're just gonna measure your pupil dilation, okay? All right, your pupils dilate good. All right, and I would say they're at about a 3 for your pupil dilation. All right, and then so normally now she would do the Snelling chart for the eye chart, and we have done that, and she has 20/20 vision in her left eye and 20/20 vision in her right eye as well. All right, and then now we're just gonna check for any lip lag or anything. Now open your eyes for me. All right, that looks good as well. And do you normally wear glasses or contacts? Which one do you wear?
Glasses.
All right, and what do you normally wear them for?
For reading. For
reading, okay. All right, sounds good. All right, so that completes your eye assessment. So now we're gonna move on to your ear. So I'm just gonna inspect your ear, and is there any pain or anything? Have you noticed any extra wax buildup in your ears or anything?
No.
All right.
Dump the otoscope.
Alright. Now I'm going to stick the ophthalmoscope into your ear. Let me know if you have any pain. Alright, and your eardrum and your tympanic membrane look nice and pearly. In your left ear, so check your right ear. Alright, your right tympanic membrane and eardrum look nice and pearly as well. No wax buildup or anything noted in either ear. Alright, and so now we're going to do the whisper test. So if you can close your left ear, I'm going to whisper into your right and just tell me what you hear, okay?
Okay. ABC.
Alright, and I'll do the opposite.
1, 2, 3.
Alright, good. So that completes your ear exam. Next we're going to move on to your nose. Have you noticed any congestion or anything?
No.
Okay, good. Alright, so your nose looks nice and symmetrical. So I'm going to use the otoscope as well to look up into your nose. Alright, nice and clear. Alright, now I'm going to check your sinuses and let me know if you have any pain or tenderness. Your frontal, your maxillary, and then your ethmoid. Alright, any pain noted when I did that?
No.
Okay, good. Alright, so that completes your nose exam. So now we're going to move on to your mouth. Have you noticed any ulcers or cracks or anything on your lips or inside your mouth?
No.
Alright, your lip color looks nice and pink, which is good. No noted cracking on your lips. Can you go ahead and open your mouth and inspect your oral membrane? Alright, looks good. Nice and pink. Alright, and then, so now we would use the tongue blade as well to test. Alright, and then we'll do the swallowing again. And swallow for me. Okay, good. No noted pain or anything here?
Nope.
Alright, and do you brush your teeth often or?
Yes, twice a day.
Good, keep that up. Alright, so that completes that. So next we're gonna move on to your neck and we're gonna inspect your thyroid and your lymph nodes, okay? And just let me know again if you feel any pain or tenderness. Alright. Does that feel okay when I did that? Okay, good. Alright, so that completes that, and so now we're going to move on to your assessment of your skin. Your overall skin appearance looks good. Have you noticed any extra moisture areas or anything?
No.
Okay, and then check for your temperature. Alright, and then check for your legs. Alright, your temperature. Overall temperature feels nice and good, no extra moisture or anything. I'm going to check your turgor. Okay, alright, can I see your hands for a second? So I'm going to check for your vascularity. Alright, and your capillary refill looks good, less than 3 seconds, so that's good. Alright, and no noted clubbing of the nails or anything. And do you have a history of smoking or anything?
Nope.
Okay, good. Alright, and there was no edema noted in your legs besides the normal swelling for your pregnancy, so that's good. Keep that up. Alright, so that completes that. So now we're going to move on to your respiratory. Have you noticed any coughing or sputum or anything
No.
that causes shortness of breath or anything like that? Okay, good. So your chest is nice and symmetrical, so that looks good. So now I'm going to go ahead and disinfect here. Alright, and I'm going to come around the back side. I'm going to put my hand on your, and when you feel my hand, just say 99.
Okay. 99, 99, 99, 99, 99, 99.
Alright, nice good vibrations for your lungs. So while you're back there, I'm just going to go ahead and listen. And when you feel my stethoscope on your skin, just take a deep breath, okay?
All right.
And a deep breath. Alright, deep breath. Another deep breath. Okay, good. Alright, now I'm going to go ahead and do the same thing on the front. And just take a deep breath when you feel my stethoscope. respiratory health inspection came out good. So now we're going to move on to your cardiac. So I'm going to just go ahead and feel first. Okay, now I'm going to go ahead and listen. Alright, so your heart sounds came out good and nice and clear, no murmurs or anything noted. So now we're going to do your pulses. So I'm going to start with your temporal pulse. Alright, and your carotid. Alright, now your brachial pulse. And radial. Check your brachial pulse on this side, your left, and then your brachial on your right, left side as well. And then your apical pulse. Alright, now we're going to do your femoral pulse. Okay, and then your popliteal pulse. And then now we're going to go ahead and do your posterior tibial and dorsiflex pedi pulse. Alright, so you have nice strong pulses in all areas, so you can go ahead and sit up. So that completes our head to toe assessment for today. Is there any questions you have for me?
Nope.
Alright, good. So I'm going to go ahead and give